These patients that have been waiting for a kidney transplant, they're depressed.
The COVID-19 pandemic put a strain on doctors to protect transplant receivers from the risks of COVID-19 as they erred on the side of caution at the beginning of the pandemic, leading to a 20% decrease in the number of transplants performed in Quebec. But experts say they've now developed an effective screening process that is allowing them to get back on track.
We had to make sure we were not going to transplant the virus along with whatever organ we were transplanting. And that is especially important because organ recipients, they need to go on medications called immunosuppressants, which are going to decrease their immune system to make sure they don't reject the organ, which could put them at increased risk for severe outcomes if they get COVID.
Transplant Quebec's annual report reveals that in 2020, 100 less people received an organ than in 2019, and that potential donors decreased 18%. The cause mainly attributed to the pandemic, as doctors will not take organs from someone who died of COVID-19 in order to reduce risks as much as possible.
The risk of transmission from other organ donations, such as kidneys, liver, it seems like it's hypothetically possible, but it seems quite unlikely that would be transmitted. And we do not accept organ donors at this point who have active COVID. So really, we're only going to be taking patients who have had COVID in the past, but we've really confirmed that they've cleared that infection.
Some patients like Luisa Miniachi Di Leo, who has polycystic kidney disease and is currently living with 30% lung capacity, contracted COVID-19 in December. She says an opt-out option policy should be put in place everywhere. Nova Scotia became the first jurisdiction in North America to implement a policy of presumed consent for organ donation in January. This means everyone in that province is considered an organ donor unless they opt out. Those under 19 are exempt.
As morbid as it may sound, all these people that died of COVID, right? They couldn't become organ donors to save lives. So this is something I think the government needs to really consider because, I mean, it's only going to help your fellow Quebecer.
If you have decided that organ donation is something that you would want after your death, make sure your family knows about it. That's probably the thing that an individual can do the best, and that makes the situation much easier for everyone.
Dr. Weiss says a return to near normal levels of activity for transplants is expected soon, adding that the waitlist has not seen a dramatic increase in the past year. In Montreal, Samsara Rainville, City News.